In the midst of the pandemic, appointments for flu shots are now filling up fast. Western Mass News checking in with local doctors on the availability of flu vaccines, especially following the governor's mandate for all students to be vaccinated.
Is this statewide order already leading to some type of shortage? Western Mass News reporter Sabrina Riley getting us answers tonight from a local doctor.
It probably takes up 80% of my day is thinking about vaccination.
Dr. John Kelly with Redwood Pediatrics in East Longmeadow says his office has been busy vaccinating children in Western Mass.
But what we are doing is vaccinating everyone who comes in the office for any reason. And we've been doing drive-through flu clinics. So people come through, they register at one door of our office, and then they drive around after they register, they drive around the building, and then our staff gives the flu vaccines to the children while they're still in their cars.
It comes ahead of the statewide mandate requiring all students to get their flu shot before the end of the year.
Not only great school students, but preschool students, college students, anyone going to college in Massachusetts. As I understand it, most school districts, even if they're not in person and they're doing remote learning, are still going to require the vaccine.
Dr. Kelly saying that this push from the state is bringing in patients who haven't been vaccinated in years past.
The vast majority of my patients and in our office have been getting the flu shot routinely for years, so it's just what they do every fall. There's a handful of folks that this is the first time their children had a flu shot in a number of years, and they're doing it because of the mandate. And they're kind of being reluctant dragons about it.
And Dr. Kelly tells Western Mass News that while many people may not want to get this vaccination, the state of Massachusetts makes it very easy for children to get their shots.
I think also it comes from the top, from the state. The state makes vaccination a priority. So we get almost all of our vaccines for our children come from the state of Massachusetts, paid for by the taxpayers of Massachusetts.
Something he says will actually help with the supply and demand concerns this year.
I think we've had one day where we were down for 4 or 5 days without any vaccine in the office, but that's been the exception and not the rule this season. Usually we order private flu vaccine for our staff and for those patients over age 19. This year we haven't been able to get our hands on any of the private flu vaccine.
And even though his office has yet to see a case this year, he is siding with the state, saying it's best to be safe rather than sorry.
From my standpoint as a pediatrician, it's a good public health move. Okay, we're in this for our community, and in order to keep flu down this winter, we really need to do as much vaccination as we can.
For Western Mass News, I'm Sabrina Riley.